Now, there's been mixed reaction to the decision by the City of Johannesburg to close liquor outlets by 6 p.m. on New Year's Eve. The city's public safety MMC, Newzroom says this was in an effort to reduce alcohol-related violent incidents. At the same time, the Western Cape Health Department urged residents to drink responsibly as emergencies related to alcohol increase in the province's hospitals. For more on this, we're joined by Ntimane, who is the convener of the National Liquor Traders Council. Lucky, thank you so much for the time. Happy New Year to you as well. Your reaction immediately to, this decision then by the Johannesburg Metro, and of course the warnings around just excessive alcohol use as well, particularly then to close those stores in the CBD from 6 p.m.
Good morning, Arabile, and thank you for the opportunity. And let me extend our festive season greetings to all the Newzroom Afrika viewers. Look, we were taken aback by the call by the City of Johannesburg that traders must close at 6 o'clock or 6 p.m. But we've seen the clarity around that this was merely a request. But what concerns us is that some of these suggestions or proposals that are coming from government circles, not just in Gauteng, but in also other parts of the country, that they almost seem to be geared to be targeting black-owned businesses, because no one is talking about closing the bars at hotels, no one is talking about closing retailers, but it is seeking to close only those small black-owned businesses that thrive and continue to support a large part of the economy in a township environment. So that is our concern. But we've also seen and the issue in the Western Cape, which cannot be ignored, the issue of drink and drive, the issue of irresponsible use of alcohol, which lends itself into trauma cases now in hospital. And when you look at this, there's no linkage whatsoever that this could be emanating from a tavern environment. But be that as it may, responsibility needs to be taken around consumers who buy alcohol and decide to get behind the wheel, but also those that do not know their limit and they just drink as if nothing. There's no consequence to them overindulging in the alcohol beverage. But we know that the majority of our people drink alcohol responsibly. But our issue remains the rotten apples, which seeks to paint the alcohol industry in a bad way. And we need to come with solutions where we don't wait just for December period to deal with issue of reckless driving, we deal with issue of underage drinking. But it should be a conversation, and we need to understand what are the consultant factors, what are the social indicators that leads to people wanting to find solace in alcohol and not in other products or other beverages.
But like one must admit, though, that in a situation like this, in this time, you find a lot of alcohol-related incidents, whether it be accidents, whether it be fighting, whether it be gender-based violence incidents as well, which of course is a massive, massive scourge in the country. And that if we were able to reduce the amount that can be then taken on, because clearly the struggle also is that we still have a society that is still influenced greatly by alcohol, that at least if we take away parts of it, that perhaps things may change. Is that not the aim here?
I think we need to learn an example of how we as a country came together to fight HIV and AIDS. We fought it not because we policed how people behaved, but because we encouraged awareness around communities and society. So something similar needs to be done with the issue of alcohol abuse and irresponsible usage of alcohol, where you cannot police social behavior. So wanting to bring in police to clamp down on consumers and traders alike is not really going to give us a solution. Let me give you an example. So if you look at the City of Johannesburg, if they had succeeded, in forcing traders to close at 6, what people are going to do is they will just move to the next region. They'll drive to Ekurhuleni, they'll drive to the Tshwane, for example, and buy alcohol there. So inadvertently, you are not encouraging people to go buy alcohol somewhere, and likelihood is that they will drink on their way back into the City of Johannesburg area. So it doesn't really help. I think the challenge that we have as a country is that we do not have a uniform or a national strategy of dealing with alcohol abuse. Hence, we find various municipalities like Mthatha, for example, which propose closing at 9 o'clock, that people are just making decisions on their own without any basis on science. And in this instance, no basis in common sense as well. So we need to be able to find a national strategy that is going to be coherent and address all social issues that we're dealing with in the country, most especially as it pertains to alcohol.
You gave an example of HIV. Let me give you another example that we can perhaps use here, and this is cigarettes in the country. Despite the awareness campaigns that the country ran for a distinct period of time, and then ending all partnerships that they've had with, whether it be advertising or whether it be partnerships with endorsements and the like, still, till this day, there are more cigarettes smoked today than previously, including things like vape and the like. So while we've created that awareness campaign, it doesn't necessarily mean that that element then goes away, for example. So that's why I'm asking, should there not be more drastic measures? Should there not be more collaborative measures to find out or at least deal with the scourge, which is to some correlation, not necessarily always direct, but some correlation with the occurrences that we are seeing across the country when it involves violence and the like?
I think we need to admit that we understand the reasons behind some of these proposals. The challenge that we have is how they want to go about addressing the issues that they highlight, which are real issues that we need to tackle. But if you look at the cigarette the cigarette industry, as you have mentioned, almost now 60% of cigarettes in South Africa is fake or counterfeit. Now, if you are going to restrict the sale of alcohol from legal channels, people are just going to go and buy it from illicit and illegal channels, which now amounts to just over 25 billion rand in the country. So you're not helping anyone. People are still going to have access to alcohol, but what it's just going to do is ensure that you deny government that fiscal revenue that they generate from the industry. And yes, I do take your point that some of the awareness campaigns that were done in the cigarette space might not have yielded the necessary results. But the example that I gave earlier of how we as a country managed to deal with HIV and AIDS is that the best way to do it is that you do not police the behavior of people, but you encourage them to have options. For example, in the tavern space, we encourage our patrons that they should have access to water, and also our traders that they should provide meals, for their consumers. They should be able to buy when they are sitting and enjoying the alcoholic beverages in their establishment. So these are some of the interventions that we believe will make a difference. But also the tavern owner has the power over their patrons, because 90% of people that drink at the tavern are known to the outlet owner. So the outlet owner exercises some power to a certain extent, where they can encourage people to drink responsibly, and those that have consumed more than what is required could be nicely sent home.
Look, I also take on your point with regards to the counterfeit cigarettes and the counterfeit alcohol, which could, of course, become a problem. We saw hints of it at the very least, particularly during the pandemic, of course, as well. So, Lucky, then long term, how do we change the behavior?
I think we need to face the reality that this issue of having 9 different liquor boards in the country is not going to assist if we want to develop a current strategy. Be that as it may, maybe we agree that the 9 liquor boards are necessary, but we need a national strategy that is going to address the issue of irresponsible usage of alcohol. Because this is a problem that we've avoided for a long time as a country. We need to understand what are the societal factors that lends themselves into people drinking alcohol the way they do. We need civil society, community leaders, NGOs, social development, the health department, so that we come together and craft a strategy that is going to ensure a future for our children that is free from dependency on alcohol. Like we've seen now in South Africa, in order to be seen to be cool, in order to be seen to be happening, there needs to be alcohol next to you. That cannot be. We cannot clarify alcohol in that way. Yes, we do sell alcohol to make a profit, but we have always contended that we are putting the lives of our people, the social fabric of our communities ahead of the profits that we could potentially make.
Yeah, because that's going to be very important to at least share the message of. Lucky, overall, how are liquor traders faring in the country? And I talk about it, yes, from a profitability standpoint, but from a sustainability standpoint. Are we able to sustain those businesses, keep them going ultimately, in a time when, of course, there are question marks around how much alcohol people should be drinking as well? We're worried about the activity and behavior of people in and around alcohol. So are liquor traders just selling now because they have to make that profit? Or how much of a concern is there, as you made note of, to social justice, for example?
If you look at a tavern setup, it is meant to be a hand-to-mouth type of business. It's a sustenance business. These are not businesses where the owners have got big ambitions of buying big cars, but their main aim is to put food on the table, to send their kids to school. That is the reason why taverns exist. And historically, as we might know, they used to be called shebeens because they didn't have license then. And with the new dispensation of the democratic government, they were then having an opportunity to apply for liquor license. And now they are running as taverns, with the exception of where we still have, shebeens are being given permits to operate as licensed establishments. So this business is not something that can sustain prolonged policy uncertainty, where someone at a whim can just make a decision that they're going to be closed down. The only opportunities that Tavern actually have in a whole year to make money is mostly in December period, where 30% of our sales are derived from. We have school fees in the next few weeks to pay. We've got kids that we need to send to varsity. So if you're going to deny taverns, for example, an opportunity, even that extra hour to be able to generate an income, is going to be dire for us. We do not just sell alcohol because it's a nice thing to do, but because it's the only thing that we can do to support our families.
Yeah, Lucky, very interesting. Thank you so much for the chat as well. Thank you for joining us here on Newzroom Afrika, all the way from Ethiopia as well. But we still continue the conversation on local matters. That's Lucky Ntimane, then, of course, then the convener of the National Liquor Traders Association.